We are going to show you exercises to help improve your tennis elbow symptoms. These exercises are designed to help improve your tendon strength, reduce pain and improve your function. It's essential that you are patient. It may take some time before you start to notice some improvement, anything up to 6 weeks. If you've not had tennis elbow for a long time, such as a few weeks, the advice and the exercises given place you in an excellent position to make a full recovery and resolve your symptoms. If you're starting the exercises later on down the line, you will still improve, but it may take some months to fully resolve your symptoms. It's worth noting that tennis elbow will eventually settle. By following the exercises and the advice given, it will hopefully speed up your recovery. The tendons that cause discomfort in tennis elbow are involved in holding the wrist whilst you grip. This exercise will involve you keeping your wrist and fingers static whilst you resist movement with your opposite hand. Start in standing with your elbow flexed and tucked into your side. Start with your palm facing in and your fingers straight. Gently and increasingly as is comfortable, apply pressure from your other hand, close to the knuckles and the base of the thumb, but do not allow your affected hand to move. Hold for several seconds, relax and repeat. If this seems easy and does not provoke symptoms, progress by applying the pressure along the fingers. You can then progress this further by slowly extending your elbow forward as you apply the pressure. Once you feel these are easy, and for some this may be from the outset, turn your palm to face the floor and restart the progressions. Start with pressure over the hand, progress to over the base of the fingers, then fingertips, and progress to moving your elbow forward. As you progress, you can apply more resistance from the opposite hand. In standing, holding a weight. Start with a low load or no load if particularly sore. Start with your elbow flexed and your wrist is flexed up. Make sure your shoulder is relaxed and roll back rather than slouch forward. Slowly lower your forearm whilst also lowering your hand at the wrist. Continue until your elbow is fully straight and your wrist is flexed back. Pause at the end. Rotate your forearm so that the palm is facing forward. Lift the forearm by bending at the elbow until it is fully bent. Rotate your hand to the starting position. Repeat slowly to fatigue. For this exercise, you'll need a long object with some weight to it, for example, a rolling pin or a hammer. When starting this exercise, start in standing with your shoulders relaxed and rolled back, not slouched. You hold your elbow tucked into your side at 90 degrees. Start with a gentle grip, trying not to aggravate your usual discomfort. Slowly rotate the bar out to the side, back to the midline, then the opposite way. To make this exercise easier, you can start by holding the bar in the centre, then progress to holding it towards the end. You can then use a weighted bar, for example, a bar that has a weighted end, for example, a mallet. To progress this exercise further, you can do the exercise with a straight elbow. It is important that you keep your shoulder back, and when you rotate, you watch the crease of the elbow to make sure you're rotating from the elbow, not from the shoulder. This can also be done with your arm out to the side. This exercise will help maintain mobility throughout your arm. You will need a towel for this exercise. Stand facing a wall with your hands on the towel, slightly gripping it. Start close to the wall so that your elbows are flexed. Slowly slide the towel up the wall, lifting up through your elbows. As you straighten your elbows, lift your heels to raise up onto your toes. This helps use the muscles in your shoulders. To progress this, you could add a small weight into each hand to slide up the wall, and then progress to doing the same movement without the wall. You should try and exercise 4 to 5 days a week, as this gives the muscles and tendons some time to recover. You should start with a low number of repetitions and gradually increase over time. For exercises using a load, you can use a weight such as a half-filled bottle of water, tin cans, bottles of liquid, or even a hammer, and gradually increase the weight over time. You may find that the exercises make you sore. This is usually a different type of discomfort than your usual pain, and it's because you're using your muscles in a different way. Some mild discomfort during the exercises is okay, however you shouldn't push yourself to the point where your elbow becomes more and more sore. The exercises can be adapted by you every day according to your symptoms. It's important to consider the different elements of the exercise that can be altered. Load, or the amount of weight. The less weight is easier on the tendon, heavier weights are harder. Repetitions. Less number of repetitions initially, increasing to more number of repetitions until the elbow becomes tired or fatigued. Frequency. Each day versus alternate days with rest in between, and position and grip. These will be discussed during the exercises. All of these factors change the amount of work that the tendon has to do. You should aim to progress each element one at a time. However, on some occasions, you may need to regress and take a step back. That's normal for any rehabilitation program. This will depend on your symptoms and the activities that you're doing on a day-to-day basis. It's really important to stay positive and strong and focus on the progress that you've made over a longer period of time, such as a month, rather than comparing week-to-week findings.